Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV 9.
Good morning and welcome to Ethical Perspectives on the News. I'm the Reverend Tom Capo, minister of People's Church, Unitarian Universalist, and I'm your moderator for this morning's show. In May of 2012, Governor Terry Branstad line item vetoed $500,000 allocated to funding Iowa's food bank network. Lieutenant Governor Reynolds said private donations are the best way to support the food bank. She went on to explain that when the government takes over and starts putting in place an allocation, other people kind of step back and think the need is not there to continue to help and support the effort. However, the food bank of Iowa's total revenue decreased by about $400,000 from 2010 to 2011, and 2012 does not look much better. The primary reason for that was a decline in private contributions. And there is an estimated 383,000 Iowans struggling with food insecurity right now. Now, Iowa is one of the few states, of 12 actually, without a state-funded emergency food program. I looked up online, and many of those other states spend millions of dollars supporting emergency food banks. Does our state need to get involved in helping those who are in need? Or is it reasonable to expect that private funding can keep pace with those who are in need? What can private citizens do to help homeless, those who are struggling with food insecurity? Who is ultimately responsible? To explore these important issues, and they're pressing for our time, we have with us today, to my immediate left here, Harlan Gillespie, who's the pastor of St. Paul's United Methodist Church. Thank you for being here. And Renee Schulte, who is currently the Iowa State Representative for the 37th District. Is that correct? Okay. And to her left is Judy Weinstein, a local attorney and member of the City of Cedar Rapids Board of Ethics. Thank you all again for being here. Well, let's start with just a general question. With this reduced funding that I've been talking about for food banks, our food bank system, is it going to be able to keep up with the demand in Iowa? We're seeing more and more people homeless. Do we know of anything that's in the works to help these people? What do you think, Harlan? Are we?
Well, I think there's pretty strong evidence that the food banks have been drawn upon much more, especially in the last several years, and especially in the last year or so. Churches are attempting to get as much food as possible into the food banks and donations, and also donations for cash to buy food. But I believe that the basic premise that needs to be asked, or needs to be questioned at least, is whether or not this is something that's only done by voluntary donations or not. It seems to me that there is a level of support for the general public that needs to be a part of the government's responsibility in this, through the taxes that we pay in various particular ways. Not to supply all of that, but at least to provide a very basic level of that sort of thing. Mm-hmm. I think that therein lies probably the biggest question in this day and age about whether government has any responsibility at all for that.
Well, government is supposed to be for the common good, mm-hmm. right? Mm-hmm. Renee, what do you know about all this? I mean, how is the state legislature dealing with some of these issues?
Well, I voted to increase the funding for the food banks, and so we were disappointed when the governor made the decision he made. The lieutenant governor has explained her perspective on this, and as you know, the federal government does contribute in a large way to our the food supply in the SNAP nutrition program, and so I believe that the governor and lieutenant governor don't feel that the state should do that in addition to federal government, as tax dollars are already going to these programs. But I do agree that the need is greater, and there are things being done in our churches to try to increase the food demand. I know our church is working on the Yes We Can food drives, and we've done multiple ones this year trying to fill those needs. But it is an interesting question as to whether or not the state should also step in, and whether or not we should take more of that on ourselves as a government.
Let me ask, just for our viewers, and what is SNAP?
The SNAP is the Supplemental Nutrition Assistance Program. It used to be called food stamps, and they just recently changed the name of it because they would like it to be more about nutrition and less about just whatever types of foods you can purchase. But that's the federal level of programming that we get, and the state passes that through. We don't have any revenue or anything attached to that, but the state Department of Human Services does look at that program, making sure that it gets put out to the right people. There was data back before 2010 showing that although our poverty rates were increasing, the number of people using those assistance programs were decreasing. And if that trend continues, that explains your gap and your meal gap that we've been talking about, and the people not using supplemental services from the government. We're going to have more people in need that need food bank services. And so there has been a conscious effort by the state to make sure that we get people signed up that can get that assistance.
Okay, so there is some initiative right now to get people signed up so that there are fewer people who are on the rolls that need that food.
I believe so, because we were seeing a trend of people not signing up, and in Iowa, a lot of Iowans are proud, hardworking people, and they want to take care of themselves. And so it's sometimes very difficult to say that you need help, but we are seeing people feeling more comfortable, I think, coming to our churches and to our places of worship for food assistance, rather than maybe getting the help from the government. And so we still have to turn around that attitude and try to figure out, if we're going to work at this as a partnership, how do we get people already utilizing all of those services that are available? And we had more money available to folks in those programs than were actually using those programs.
Judy, what do you know about all this?
I'm approaching it somewhat perhaps differently. Okay. And so I look at the SNAP program as the federal program, which is obviously covering the entire country. So then I look at, well, what is the policy approach a state should use and local communities? At the state level, I see the state program, each state as unique, dealing with the unique aspects or problems of that state. So if it's an unemployment issue, if it's disaster relief, which is resulting in serious food hunger needs, whatever those are, the state should be looking at that and creating policies that support the community. And then when I look at the community, I say each community itself is unique and has to have a community-based program. In each of these levels, however, there really needs to be participation with the government, business, nonprofit, community leaders. And I also strongly believe, which I do not hear in this state, the bully pulpit. What I do see is there was a fabulous effort in the Blue Zone Project, and in part that is healthy food. I have not seen the bully pulpit used for hunger. And if you want to look at it from economic development, it is a negative cost to the state, to local folks, if we have people who aren't healthy. It's a drain on health resources. It's a negative impact on employers because they cannot hire people who are not healthy. You cannot create an employee base if they don't have access to food. You cannot create an educated segment of the workforce coming through school with no food, who have those impacts, those negative impacts. So I don't see the bully pulpit in the state dealing with the lack of food. I've seen the bully pulpit on the idea of healthy food, but quite frankly, healthy food, I think, has to be discussed as part of the hunger equation.
Okay, But also, besides the bully pulpit, and I think that's an important issue, what I also hear you talking about is policy.
Correct.
And kind of a holistic or comprehensive policy that incorporates all aspects of public-private coalitions to help those in need. Do we have something like that? Or is there, Renee, are there any kind of policy within the state level that kind of looks at all the different ways that those who are in need are helped?
Well, I know that the Food Bank Association is one of the groups that comes and talks to us at the Capitol about the needs for food and shortage. And even though there seems to be an increase in Iowa, we're only 11th in the country on poverty. And so we're actually doing really well compared to most of our neighbors. And so that is an issue that is, trying to make sure that people understand that we do have growing poverty, but at a much slower rate than the persons around us. So the food groups come and talk to us. And so one of the programs we did as a policy initiative was calling Map the Meal Gap. And that was a project that was implemented last year and I remember the press conference with Lieutenant Governor talking specifically about figuring out how to map those gaps in your meals and trying to figure out exactly what that is in a cost so that we can determine how to go about that in a collective way to address it. It's very challenging to know exactly where those shortages lie and finding out, you're talking about people that are not maybe fully fed, but how much is that? And if you had to put dollar amounts to that. So I know that that's one of the pieces that's been working toward is getting better data to give the legislature something to really work off of and see, what is the private contribution and then what should that public contribution potentially be.
In the bully pulpit, too, I mean, we're not hearing a lot from legislators on this issue. At least I haven't heard a lot on this issue. But like we had the blue zone, and it was being healthy and eating healthy and having access to healthy food, but not so much in terms of we have an increased homeless population, increased children who are homeless, and how do we go about helping them? I haven't heard much coming out of the state on that. Have I missed something, or?
You really haven't. I mean, the governor has focused on his Healthy Foods Initiative and talking about being the healthiest state in the country, which is related to the blue zones. But other than that, there has not been a large conversation being held about issues related to these things. The closest thing you had to it was the initiative last year to redesign the mental health system and to look at folks that are falling through those cracks. And not all of these people are exactly the same, but there are many in common. And so that big initiative that just is in the process of getting kicked off and kind of redesigning that system should be helpful to pick up a lot of these folks, because this fall we're looking specifically at children in a system there. And the idea that you're talking about is somebody following them through to making sure that their needs are met, that isn't happening today. And so there's a system where people can fall through cracks, and it sounds like this system is very similar, where there's not really a cohesive way to get food. And so if people are traveling all these different places to get their food needs met, it's hard to get a real true picture of that family's need.
We have, we're no different than probably a lot of other churches in terms of what we see. Our location probably helps us see some of it more than others, but in terms of the core of the city, I think what gets lost sometimes are actually putting faces to people who are hungry, and the lack of food, and also the lack of cohesiveness. There are a few, very, very few children that might be overweight that are coming to food programs, but most of them are pretty pencil thin. And they're hungry on weekends. They're hungry beyond the meal that we serve as neighborhood meals programs across the city. Hungry beyond the lunchtime, and there are some places for them to go on weekends, but very, very few in relation to that. I don't think, in one sense, I don't think we have to wait for the state or the federal government necessarily to create a comprehensive program for us to be able to address those needs. We have not probably all the resources, but we do have some resources in the Cedar Rapids area to address that. If we could end up with a coalition of nonprofit agencies and coming together around various issues, whether it be poverty, hunger, and so forth, we haven't really done that sort of thing. In terms of bully pulpit, I hope I don't use my pulpit to bully people.
Hope so too.
I was waiting for that.
But I will say that there is not really there's not really, I found strong voices, other than perhaps some nonprofit directors and some church pastors who are speaking strongly about this, that this is a sign of an unhealthy people. And I mean unhealthy in the deepest spiritual sense. That there's this much hunger. I mean, granted, we're only 11th in poverty, but being 11th in poverty is no great thing to be. I mean, it's still, there's a lot of poverty around us. And I would like to see more things strongly being said. It's still, I think, a pretty much fact that healthy foods cost more. And so therefore poverty has an influence upon healthy foods, or whether they're, I mean, poverty means that you can't find them for most people who are hungry. It's the same thing that needs to take place in terms of homelessness. A really strong community effort to do that sort of thing. Now, some people will argue that if we have great comprehensive food programs in the Cedar Rapids, Marion area, that will cause other people who hear about it to come in who aren't getting food in other places, which is the same argument against providing homeless shelters and homeless programs oftentimes. Others will start coming to this area, and I think that's still a false argument. The challenge ought to be that every community, every governor of every state needs to step up and start using their voice to advocate for more than just simply balanced budgets, but balanced lives. And everybody's talking about balanced budgets as if we balance a budget, somehow that's going to take care of every human ill that there is, or that somehow other people that will step up and do such and such. Statistically speaking, from what I've seen over the years, is that the more public funding that goes down for various things that need to be addressed socially, there is not the corresponding increase in private donations. It just becomes even less and less out of mind when it's taken out of the public arena that way. And quite frankly, I'd like to see the governor stepping up more, talking more about the need to feed people. And if he really does believe that the best way to feed people is to have private donations take care of it, then get out there and say that over and over and over again. Not just make one statement, but get out there and advocate for that. Visit food pantries, invite people, challenge people to give to food pantries. But he doesn't do that. I don't think it's on his radar screen.
Okay. Judy?
Well, I actually have a question. My understanding of the Iowa Food Bank is that it does not cover our area, for instance, and so we have some existing coordination, although you alluded to maybe it's not as cohesive as it should be, or am I wrong?
Well, as far as I know, Iowa still doesn't have really a comprehensive food bank system in which there's bulk buying done,
right,
that's then distributed to various other nonprofit food groups or nonprofit food banks. And one of the challenges in, say, an area like Cedar Rapids, Iowa City, and other communities in Iowa is that while there's one called the Linn County Food Pantry, which is housed at First Presbyterian Church. Not all the churches support that. Many other churches will have their own food pantries, which then increases the probability of people needing to go from place to place to place to place. And of course, this is my opinion, but it does not mean that it's an effective use of the gathering of food. And we don't really get a clear sense of the need because of that.
Right, there are gaps in the system, and we don't know what those gaps are because there isn't any comprehensive program. And that's true of other things as well.
Yes.
Homelessness issues, housing, and getting resources for the poor.
Energy assistance type things.
Yeah.
Yeah.
So why don't we have this statewide coordinated program?
Well, you do have, the statewide group for food bank in this area is the HACAP, and they're the ones that get
Okay.
the federal fundings specifically for nutritional foods.
Okay.
And so that they are the statewide location here in this area, and they then tie in with the rest of where the federal dollars are. So there's coordination with the dollars that are federal. What
Right.
isn't happening is your privately organized groups are not working together with those federally funded agencies as clearly as they should be. That's what I think. So what you've got is the gap between potentially partially coordinated private side, coordinated federal side, but not connected in the middle.
Okay.
And I think that's kind of where it's disjointed. And so on the private side, if you've got multiple church collecting and going to different locations, then you do have those families having to move place to place, which makes it more challenging.
Right.
Oh yeah, I remember when we were, our People's Church was downtown, and we'd have people who would go from church to church for different things, food or busing or whatever, and they didn't know where to get the resources. And if we didn't know, if we didn't have the resources, if we didn't know where they were located, they would continue to go from place to place to place. So there is a need. And so should the government be involved in that, trying to coordinate all that, or how should that look, do you think?
Well, the governor doesn't think so. The governor thinks that that's what the private sector is supposed to be doing, and it's
coordinating all of
well, if that's what if they want to coordinate it, because like I said, the federal government side is coordinated among themselves where those dollars go, because we keep track of those dollars for taxpayer purposes, and so that's probably another reason for, I would guess, the veto is putting state dollars then into that. If it's a non-coordinated system, that's going to be very challenging for him to want to support from that perspective, and so. You know, unless somebody steps up to make it coordinated, to make it so that you can track where those dollars are going and making sure that there's benefit for those dollars, it's going to continue to be difficult to do. You know, we have with children and families thinking about some of the other people out there helping. I wanted to speak to the foster parents that are out there in the community. I was one of those for a long time. And we picked up a lot of those folks that had no food, that had the gap. And it's challenging for them because their reimbursement rate's only at 65% of the USDA rate. And so they're not only feeding their own children, but also the extra children in their homes. And so they are out there making a difference the best they can. And so it's a collective group of us that are all out there trying to do the best. But you know, it would be nice to have somebody step up that wants to coordinate that on our side, especially in a community our size.
Well, you stepped up, and as far as mental health is concerned,
Yes.
and have tried to coordinate throughout the state, you know, how we can provide services across Iowa in a more equitable fashion.
Correct.
Is there a way for the state to do the same in this area?
It'd be an interesting, I think the answer would be yes. I haven't had anybody ask us to do that. The mental health kind of fell at our feet because of a lot of challenges with that, and the state dollars and the federal dollars involved sort of pushed that to the forefront. And a lot of consumers and families were upset about not having choice, and so that helped push that to the forefront. And this is a different issue. We don't hear a lot about this issue the same way. We haven't had a group from here come and say, this isn't coordinated, we need your help. And so usually, from my perspective, just being there the short time I have, we don't step in to help fix something that nobody thinks is broken or nobody brings to our attention. And so when the governor it's not on his top agenda item, it hasn't been on others, and so it's just not as prevalent, nothing that we hear about so much.
Well, I remember when we had the flood, we found out that there were a lot of gaps in services. And it wasn't until after the crisis that we started coordinating efforts for disaster preparedness. I guess what I'm hearing is we're waiting for this disaster to happen before change happens? Is that?
I hope not.
What do
I hope
y'all?
not.
Well, we can hope not, but I think the reality is that nonprofits, whether they be religious nonprofits or non-religious nonprofits, usually have a way of operating in their own sphere rather than being interconnected and coordinated for various reasons. It oftentimes does take that emergency to happen before they're starting to get coordination. I can speak on the religious part of it in terms of the churches. Communities like Cedar Rapids, a number of years ago, attempted to put together a common fund, as it was called in Iowa City, as it's called here in Cedar Rapids, Helping Hands and so forth. And the idea behind that was to pool resources to help more people in a more effective way. What generally happens in most communities, including Iowa City and Cedar Rapids, from my experience, is that churches begin to think that we don't have to give as much. Parishioners think that. Once everything's all pooled, we don't have to be quite so generous. When actually that's the time to step up generosity, because a lot of the coordination effort lacks because we don't have case managers, coordinators to pull these things all together and to sort through what type of needs people have that are legitimate to be addressed. And so the funding for a lot of these things, when churches gather together to do it, the total funding actually begins to drop than when they were doing it by themselves. And that is a message that I think religious leaders have got to hear. That's not the time to pull back, that's the time to push forward. And I think this is a good example of that sort of thing.
I've certainly heard that in terms of, the food needs and housing needs and a variety of others as well, that people do tend to, we were running a program called Network of Faith, which was to try and get each of the churches to try to help some of the homeless shelters in town. But once that was set up in place, then some people pulled back, and and then felt like, oh, well, that's already being taken care of, so we don't have to take care of it anymore. So it becomes problematic. Judy, do you have any final thoughts before we wind up here?
Maybe we'll hear a few on the bully pulpit shortly. Maybe we can start it here and move it to Des Moines.
Okay. Okay. And the regular pulpit, I would imagine that we'll see.
Whatever pulpit might be regular or irregular.
Okay. And Renee, you have any final thoughts?
Well, I know that the food banks prefer our cash donations more so than food, because cash to them with the bulk purchasing power gets a lot more food than maybe our canned goods do. So I would challenge each of us to give a little bit more and just take our dollars straight to them so that they can make it go as far as possible.
Well, thank you all very much for being here today. And I know this is a tough issue, and I don't know that we can come up with a solution that is going to make everything all better. But we do need to give some thought of what we can do as private citizens and to lobby our legislators. I think we can call them and say, this is an issue, and we do think it's important. So maybe they'll begin to make a difference, come up with some policy, some comprehensive policy for our state. Well, again, thank you all for being here, and thank you all for watching us here today at Ethical Perspectives on the News. Take care, everyone.